Thanks, Kim. And welcome, everyone. I'm Henry Claypool. I use he, him pronouns. And for a visual description, I'm a white male with brown and gray hair, wearing a blue, somewhat patterned shirt. And I serve as the policy director of the Community Living Policy Center here at Brandeis University. Thank you for joining us today. We look forward to sharing our findings from our Medicaid, home and community-based services stakeholder interviews. But first, it's my honor to introduce Alison Barkoff of the Administration for Community Living. Alison serves as the acting administrator and acting assistant secretary of the Administration for Community Living. In this role, she not only oversees all aspects of the agency's work, she also advises the Secretary of HHS on disability issues across the expansive HHS portfolio of programs. She brings personal experience to this work as well. Her brother is a person with a developmental disability, and this experience really informs the work that she does at ACL and the work that she's done throughout her career. It's been essential to her adding real value into the work of the Center for Medicare and Medicaid Services as they grapple with their Medicaid HCBS programs. Of course, those of older adults and people with disabilities rely on. I had the good fortune of working with Alison during the Obama administration when she played a critical role at 3 federal agencies. She worked at DOJ, leading some of their Olmstead enforcement. She worked at CMS in the group that manages their HCBS portfolio, their home and community-based services. And she spent time at the Department of Labor, helping them implement a rule with significant implications for how the Medicaid program pays its community living workforce. And we have the very good fortune of having Alison leading ACL at this time, and we're really looking forward to hearing her remarks. So Alison, I'll turn it over to you.
Thanks so much, Henry, for the introduction, and thanks to the Community Living Policy Center team, including Teresa, Joe, and Kim. As Henry mentioned, my name's Alison Barkoff, and I use she, her pronouns, and I'll give a quick visual description. I'm a middle-aged white woman with curly brown hair, wearing a flowered blouse and a blue background with an ACL logo. I really want to start by recognizing the Community Living Policy Center and truly the unique role you all play in using research to impact community living policy. We are so proud at ACL to fund your work. And I want to give a quick shout out to the ACL team from our National Institute on Disability Independent Living and Rehabilitation Research, or NIDLR, who works so closely with the center. And finally, welcome to everyone listening in today. I really enjoyed seeing all of the introductions, so many colleagues and friends and ACL grantees. So welcome to disability and aging advocates and researchers and family members and professionals from across the disability and aging communities. Everything that we do at ACL is about ensuring that everyone has the right to live and fully participate in their community, regardless of age, type of disability, or level of support needed. The right to live the life you want with the people you choose in your own home is enshrined in civil rights laws like the Rehabilitation Act and the Americans with Disabilities Act, and affirmed by the Supreme Court in the Olmstead decision, otherwise known as the Lois and Elaine case, whose 24th anniversary we celebrated last week. But having a right and exercising a right are very different things. And that's one reason why research is so important. Research tells us the unbiased story of what's working and what's not. Research tells us what people want and need, and it helps us identify where our systems are falling short in meeting those needs and wants. And importantly, research helps us make the case about why addressing those gaps are critical. In short, research is the fuel that sets policy goals in motion. And research really comes to life when it's connected to personal stories. In fact, personal stories can be often the most potent force that promotes new ideas and fosters change. So that marrying up of personal experience with data compels action far more than either can do alone. And that is what makes the Community Living Policy Center so unique and so effective. And that's one reason why within ACL, NIDLR, and we're pushing other federal agencies across the federal government to include more researchers who bring their own lived experience of disability to this work. I know today's webinar is going to be focusing on the recent Community Living Policy Center report entitled Needs and Priorities for Community Living Policy. And when I read the report, I have to say it hit on the need for research in virtually every area that are the biggest priorities for the disability community and areas where ACL, just like the Community Living Policy Center, is taking action. For example, it includes research to better understand barriers to accessing home and community-based services, or HCBS, particularly for underserved communities. And this research is so critical to educating policymakers about the need to expand HCBS, and it complements the work that we are doing already in the federal government. Things like finalizing regulations to expand access to Medicaid-funded HCBS, the access regs still out for comment, so please comment, and also ACL's new equity-focused research, rehabilitation research, and training centers on community living. It also includes and recommends research about barriers to what President Biden calls the care infrastructure. That's the paid direct care workforce and family caregivers that provide the critical services that make community living possible. Research in this area could not be more timely. It is the focus not only of the administration, but of policymakers and the broader public. And this research is so complementary to what's happening again in the federal government as a result of the president's recent care executive order and work that ACL is doing to implement the first ever national strategy to support family caregivers and our new direct care workforce capacity building center. Another huge thing you talk about in the report, the lack of accessible, affordable housing and the barriers it causes to community living. It's a severe shortage that we have in this country of affordable housing, and then overlay accessibility, and the problem becomes extreme. And for people with disabilities and older adults, lack of affordable housing not only can lead to homelessness, but also to institutionalization. So this is another place where the research you're doing and recommending is so critical and complementing federal actions, including a partnership that ACL is leading between HUD and HHS called the Housing and Services Resource Center, where we are coordinating federal housing and service resources at the state and local level. Disaster preparedness, just one other example I want to call out from the report, is so important. COVID highlighted how unprepared state and local emergency response and public health systems are to meeting the needs of people with disabilities and older adults. And at the same time, COVID created unprecedented opportunities for partnerships between these systems and the disability and aging networks. So this disaster preparedness research will be critical to helping us make sure that we leverage every lesson learned from COVID in changing policy. I've just pulled a few examples from a long and important list, and it will take a lot of work by all of us to make headway. But the community living movement is tens of millions strong, and our voices are being heard like never before. We have support that extends from the White House to the 20,000 community-based organizations that serve as part of ACL's disability and aging networks. And through executive orders and legislation like the American Rescue Plan and speeches, including the State of the Union, President Biden has made it clear that the federal government is a strong partner, willing to take on the challenges that disabled people and older adults face in making the right to community living a reality. As Henry mentioned, and like so many of you, I have been advocating for change for a very long time. And sometimes in the moment, we might feel like the path ahead is daunting. The many research areas in the center's report are ambitious, to say the least, and critical. And there are even more that I'm sure you'll all be talking about: education, employment, transitions from institutions, measuring impacts of healthcare and social service partnerships, and more. But we as a community cannot be intimidated. I can say for myself, 40 years ago, when my parents were told the only place for my brother was an institution, they dug down and they were not intimidated. And my family worked with disability advocates from across our community and across the country to advocate for laws like the ADA and the creation of the HCBS system. And as a result, my brother is a valued member of his community and an incredible disability advocate in his own right. Together, we can make sure that all the research needs are addressed with our army of individuals dedicated to making this nation more inclusive and more supportive. And I'm incredibly proud of the role that ACL plays in funding issues that are so important to our community. That, of course, includes NIDLR funding the Community Living Policy Center, but just last year alone, NIDLR funded an astounding 245 grants supporting over 1,500 discrete projects. And our Administration on Disabilities is continuing its cross-governmental research around people with intellectual and developmental disabilities and data. Our Administration on Aging produces every year an annual profile of older Americans with critical statistics that drive policy decisions. So I'll end by saying research can make a difference, especially when we bring it together with the important stories of lived experience. Thank you for all you are doing, all of you, on today's webinar, and I urge you to keep up this really, really important work. Thank you again for having me, and I'll kick it back to Henry.
Thanks, Alison, and we really appreciate you coming today. At this point, I think I turn it over to Kim for a brief introduction of our series.
Kim, you're muted.
Oh, I'm sorry. Hi, everybody. My name is Kim Tae. My pronouns are she, her. As a visual description, I am a young disabled Asian American woman wearing a white shirt and burgundy cardigan. I'm going to introduce us to our presentation portion today. And we are going to discuss future areas of community living research. Yes. So this statement is just a reminder that the work our center does not necessarily reflect the views of our funders. Next slide, please. And as for our objectives, we have three main objectives for today. The first is to describe the process of collecting information for future areas of community living policy research. The second objective is to discuss priorities for future community living policy research as identified by stakeholders. And lastly, we're going to open up for discussion around missed areas for community living policy research. And with that, I'm going to pass it over to Henry for our next portion.
Thanks, Kim. In this slide, you can see that I'm going to describe some of the background here. We opened this with a series of roundtables, and we had about 30 plus key stakeholders in the interviews. They were loosely organized into kind of three groupings, and I wanted to give you a bit of background on these groups that we kind of worked with to convene different sets of stakeholders. First is the Disability and Aging Collaborative. It's an informal gathering of HCBS stakeholders where lots of information and perspective is shared on Medicaid HCBS. It's really at the national level. So these are national organizations that are engaged in this conversation. And they run the full range. So we have National Disability and Aging advocacy organizations participating in the Disability and Aging Collaborative. We have home and community-based services providers, state organizations, and we have organizations that represent the long-term services and support workforce, largely advocacy organizations and union representatives that join that conversation as well. Second convening was done with the Long-Term Quality Alliance and their board. And their board is pretty representative of the cross-section of stakeholders that we wanted to bring in. So they have staff from AARP, staff from the Association for University Centers on Disability, people that work for state organizations like Advancing States and the National Association of State Health Policy. On their board, they also have representatives from commercial managed care plans or managed long-term services and support plans. And they also have consulting firms that are frequently hired by states to help them with their Medicaid long-term services and supports programs. And then finally, we wanted to make sure to include the important issues around equity. And we tapped the Community Living Center Equity, the Community Living Equity Center Advisory Board for this task to round out our interviews, to make sure that we were really able to draw in the deep and rich experience that these communities have and their priorities. So with that, we then lead to, I wanted to share our findings. And I think I'll ask to go to the next slide, please. So now I'm literally reading from a draft report that we have. And remember, this is an opportunity for you all to contribute. So while we're going to have some participation time at the end, as I'm sharing these general areas and the substance underneath, you should be thinking about areas that you know and see if we've heard all the different perspectives that we need to. So on access to HCBS and unmet needs, we have access to data on HCBS as a major theme. We have available HCBS participants, and expenditure data is not disaggregated by race, ethnicity, age, sex, gender, gender identity, sexual orientation, disability type, or other characteristic. These are really important factors. And of course, we want to make sure that hopefully future research can take these into consideration. Improved data on HCBS waiting lists is another issue that came up. It needs to include characteristics of individuals on the waiting list, length of time, and how wait lists are managed. Another is stakeholders also raised issues around inadequacy of the HCBS waitlist data and the need for better population level data on LTSS need and unmet need of the state and at the state and national level. Additional research is also needed on the impacts of unmet need for HCBS in community that has on community living and health outcomes. Additional research is needed on eligibility for HCBS, including individuals near Medicare eligibility and those that are presumed eligible or presumptive eligibility. So that's a long list for that first set. Now we have cost benefit of HCBS. Stakeholders wanted additional research that demonstrates cost benefit savings for expanding access to HCBS, including reducing nursing home and institutional placement. This type of research is particularly useful to state and national policymakers trying to expand access to HCBS. And also stakeholders identified the funding that came from the American Rescue Plan and how it was used by states and the impact it had on expanding access to HCBS and to strengthen the direct care workforce. And finally, on this slide, you'll see equity and cultural and linguistic competencies. Related to access, additional research is needed on culturally and linguistically appropriate information for HCBS and systemic barriers in eligibility and the application process, basically getting in the front door. Participatory research is needed to better understand and reduce these disparities with these underrepresented communities. Another point that came out, what does community living mean to people from different racial and ethnic and otherwise cultural diverse backgrounds? What do people from underrepresented communities consider culturally appropriate services? How are processes for such person-centered planning facilitated in a culturally and linguistically appropriate manner? Additional research is needed on individuals who identify as LGBTQ+ and in need of HCBS. There is currently very little research on this population, what data limitation exists, and what barriers and disparities do individuals experience. How can services and supports be more culturally competent for folks from the LGBTQ community? Finally, additional research is needed on HCBS for tribal nations. How does the Indian Health Service interact or not interact with Medicaid? What is the quality of care provided through the Indian Health Services Administration? What is the state of access to services and supports for Indigenous people, specifically those living on reservations? So that's what we heard in this first set of we've organized that content around these first set of issues. And I'll ask to move to the next slide. Here we see that we have financing and design of HCBS programs. Research is needed on state adoption of the HCBS authorities. In particular, some participants recommend additional research on the adoption of the 1915 Home and Community-Based Services State Plan option. While this option has a lot of potential for individuals with serious mental illness and other behavioral health needs, at least that's what states have been using it for, they still aren't adopted widely to serve that population at least. So why is that the case? And what are the particular barriers and what incentives could be provided to help states use this authority better? Another theme that emerged, stakeholders discussed a long-standing institutional bias within Medicaid, where nursing home and institutional services are mandatory, while HCBS, of course, is optional for states. In recommendations for a recommendation for mandatory core Medicaid HCBS benefit emerged pretty strongly in these conversations. More research is needed on programs that integrate acute LTSS, behavioral health, for individuals that are dually eligible for Medicare and Medicaid. What are some of the promising practices? How do programs improve health and community living outcomes? And how can a value-based purchasing arrangement influence desired outcomes? Another point, additional research is needed on state programs that are serving individuals with lower level care needs, and the extent to which these programs are preventing or delaying institutional placement. Another point, policy analysis, research, and development is needed on financing of LTSS outside of Medicaid through social insurance models, such as the recently mandatory long-term care insurance benefit in the state of Washington. The next bullet, you see person-centered planning and self-direction. Stakeholders recommend additional research on implementation of person-centered thinking, policy, and practice. Person-centered planning is required within Medicaid HCBS, but implementation varies widely. Additional research is needed on state and provider compliance with implementation, promising practices, and cultural context for person-centered planning and care coordination. Another point, self-direction is a delivery model in which consumers have greater control over their HCBS, such as hiring authority and budget authority. Additional research is needed on expansion of self-direction through COVID-19 impact. Has this expansion continued, including the availability to hire family members? What are the impacts on community living outcomes and cost for this expansion of self-direction? And last on this slide, you'll see emergency and disaster planning. Additional research is needed to understand the impact of COVID-19 on individuals receiving HCBS. What have been the impact on mortality, health, and community living outcomes? What are the racial and ethnic disparities and impacts? What are the impacts of individuals living with long COVID and in need of HCBS? What policy changes and innovations should be continued after the public health emergency? Lots of learning possibly there. COVID-19 highlights the importance of disaster planning for people receiving HCBS. However, people with disabilities, including people of color, LGBTQ plus individuals, socioeconomically disadvantaged communities, older adults, have been disproportionately left behind during disasters as a matter of course. Research and policy development are needed to ensure adequate disaster planning within HCBS programs. And next slide, please. We move on to our barriers. And I think I pass this off now back to Kim.
Yes. Thank you so much, Henry. Okay, so this is one of our participation points. So now we want to hear from you. You can respond to one or more of the questions here. Our questions are, what community living policy research do you want to see for programs, policies, and practices in HCBS delivery, the topics that Henry was discussing? Why would this be helpful to you? And is there anything that we missed? I just want to say that I've been looking over the survey responses, and we are extremely grateful for the large number of you who have been filling out the survey so far, and encourage people who haven't to do it. If you also want to bring that into the chat for discussion, you're welcome to as well. And let me see what else I have here. The comments get recorded by Zoom, and so we will incorporate everything from the survey and the chats across all the sessions into the final version of the report. Just to remind us, those topic areas that Henry covered were access to HCBS and unmet need, cost benefits of expanding access to HCBS, equity and cultural competency, financing, person-centered planning and self-direction, and emergency and disaster planning. So it looks like Susan is going to give us 2 major thoughts. That's great. Thank you, Tanya, for the heads up on the storm. Appreciate it. Those categories are also in the chat. Teresa popped them in there. So Patricia has like a research question around how communities can create collaborative networks of support for HCBS with different aspects of the healthcare system. That's a great research question and a good research topic area. Looking at research for folks who use augmentative alternative communication or AAC devices. Yep, very important. Susan wants to see a differentiation between community living in group homes and real community living. Yep, we totally struggle with that in our research as to what we count a group home as. Brenda is affirming emergency and disaster planning. Tanya's got how HCBS can do a better job of supporting communication for people who need different communication supports like American Sign Language, AAC. Yep, these are great, y'all. Keep them coming. Judith has research on efficacy of managed care. And responsiveness of Medicaid administration. Yep, and yeah, the climate of that in Florida. Yeah, I want to thank everybody so much for your responses, and this will definitely be really helpful to the report and will help us be really well-rounded. I see that there are questions and topics that are wanting to be explored. Around family caregivers. Yep. Yeah, this is an excellent discussion, and I encourage you to go back through it as we continue. So thank you so much, everybody, for doing this part of the discussion with me, and then we'll do it one more time at the very end. So I'm going to pass it on to Ruby next, and Amy, next slide. Thank you.
Awesome. Hi, everyone. It's a pleasure to be here with you all. My name is Ruby Siegel, and I'm a fellow with the Lurie Institute for Disability Policy. So just a visual description. I'm a white woman with a disability. I have brown wavy hair, and I'm wearing a white sweater, and I have a tan background behind me. So we are going to transition now to talk about what our roundtable participants identified as the barriers and the supports to community living, and more specifically, home and community-based services. So our first identified research area was on the direct care workforce crisis, and this was the highest priority barrier, and it was also the most mentioned theme that we found. We learned that wages were viewed as the most important issue in regard to the direct care workforce. Roundtable participants called for documenting the workforce crisis in association with wages. Roundtable members also wanted further research on rate setting processes in states, what data is being used, and whether this is adequate to monitor and ensure access to direct care workers and HCBS. And then roundtable participants were also concerned that the inability to recruit and retain workers may lead to HCBS recipients being forced back into more institutionalized settings. So many indicated that the continued expansion of HCBS is not possible without also strengthening the workforce. So that was a really big point that was brought up, is about that interaction of the quality and quantity of the workforce, and then also the community expansion. I also want to bring in a point that was made from the chat about the bicultural and bilingual staff that we need, so that we know that the community workforce, that it's not affecting everyone in the same way. So that was a really good point. The second research area that we identified was on finding affordable and accessible housing. This is a very common sentiment among providers and care coordinators that there just isn't enough housing available. So members were curious about what research can be done to facilitate more of this affordable and accessible housing. Roundtable members also said that research was needed on promising practices done at the local level, the type of housing states are developing and for whom, research on ADA units available and utilized, and research on who does or does not have housing after a nursing home stay and why. And then finally, roundtable participants suggested additional research on Medicaid coverage of housing. So typically direct housing costs aren't covered by Medicaid, but there are ways to do this through 1115 waivers, such as through transitional housing costs. So some participants would like research on the usage and the impacts of this type of coverage. And then the third research area that we identified was on accessible transportation. Accessible transportation continues to be a major barrier to community living across the United States. In particular, roundtable members discussed significant barriers in rural areas related to transportation. So additional research could identify the promising practices and models at the local level, which is similar to what participants suggested in regard to affordable and accessible housing. Research is also needed on Medicaid payment of transportation, how states are using additional funding through the American Rescue Plan Act, and the recent infrastructure packages to improve accessible transportation infrastructure. The fourth identified research area was technology and the rise of technology. So roundtable members discussed the rise in technology usage and its impact on healthcare services, and as well as how technology can act as both a barrier to information and an access to information. So this barrier can depend on if consumers are able to access technology, if they have even physical access, or are just comfortable using the technology that maybe they do have in their vicinity. So roundtable participants recommended additional research on the expansion of technology-first practices, meaning an approach to services which embraces modern technology, but that's not a replacement for the in-person services that we do have. Also telehealth services as compared to in-person services, Medicaid coverage, and then diving further into the barriers that individuals and communities face to technology access. And then the fifth and final area that we identified was on family caregiver supports. It is commonly understood that caregiving takes a physical, mental, emotional, and even a monetary toll, and due to the barriers in access to care for HCBS recipients and their caregivers. So with that said, roundtable participants recommended additional research on supports for family caregivers, including the impacts of family caregiving and the extent to which self-direction allows the hiring of family caregivers, including extended family caregivers, those outside of the nuclear family system. And then additional research is also needed on the use of family caregiver assessments within Medicaid HCBS programs, assessing unmet needs of caregivers, and the extent to which Medicaid HCBS programs are providing respite and other family supports and services. So thank you so much, and I'm going to pass it back to Kim.
All right. Thank you so much, Ruby. Okay, so similar to our last discussion, type into the chat what community living policy research you want to see around barriers and facilitators to HCBS. Again, those topic areas are direct care workforce, affordable accessible housing, transportation, technology, and family caregiver supports. And those topic areas are in the chat for you to reference as well. Do you like these topic areas? Why would they be helpful to you? Is there anything that we missed? Yep. So Paige has using technologies like Alexas, Google, medication dispensers in the home to improve independence and potentially decrease staff intervention. Brenda is affirming accessible, affordable housing. Yep, as Ruby said, that's an extremely common barrier that really needs to be addressed. Are there any others? Yep. So looking, Jane has looking at different funding streams, as I understand it, to have greater emphasis on accessibility modifications. Yep, research that looks at continuity of support services from school and how it can translate into adulthood. Very important, especially for our young people who need access to the HCBS system. I see a comment about transportation. As many people in low-income communities do not have transportation resources to get the care they need. This is an excellent point. Guardianship emphasis on less restrictive practices. That's also a very important issue. Yep, Judith, as I understand it, is affirming the difficulty in supporting HCBS recipients in finding housing. Yep. It's extremely difficult for sure. And yes, that's an excellent point, Jane. Medicaid HCBS can't pay for housing, but HCBS can't work without housing. And as I understand it, that's people were using those 1115 waivers to kind of help with those transitional costs here and there, but there still needs to be like a better solution. And then, yeah, Henry, if you want to pop in on that, you're more than welcome to.
I would just say, yes, the 1115 now has been used in a number of areas to expand access, and it's still kind of limited to about 6 months. And one thing that the HCBS community should take credit for is the good work done under Money Follows the Person. What had really informed the agency's legal views on when Medicaid dollars could be used to pay for housing. And that was really the impetus for developing this template of 1115 waiver that gives states access to housing in this transitional period for up to 6 months. So it's a great innovation, but as everyone's noted in the chat, just so limited. We need really to address this barrier, and the research needs around it are not secondary, but they certainly don't add up to the pressing need for more housing.
Yeah, thank you so much, Henry. And thank you to everybody who contributed to this discussion. And again, we'll be taking your chat comments as well as your survey comments and kind of integrating them into our draft report. So yeah, we want to thank you so much for your input. And with that, I'm actually going to pass it back to Henry to close us out for today.
Thanks, Kim. And a special thanks to all my colleagues at Brandeis and the Community Living Policy Center. It really took a small village to put all this work together and to present to you today at the webinar. So I still see people commenting in the chat. So we really like that and want to encourage that. You can see there are other ways to contact us, and you see that on the slide here. You can contact us via Twitter at CPLC, CPL, and then policy is spelled out. You can go to Facebook for the Lurie Institute. And of course, you can get us on the website, communitylivingpolicy.org. And with that, I still see people populating the chat bot, the chat box. So I hesitate to close us out entirely. But you have these other avenues. And I just now want to give you all a special thank you for attending our Community Living Policy Center State of the Science series. You can stay connected to our work through the website, of course, and the social media. Please remember to fill out the survey if you want to add to today's discussion. And I think Amy will put the survey link in it. There it is in the chat. Or we're looking to get that to folks now. I think you see it now in the chat. And with that, I hope I'm okay to close this out for the Brandeis team. If there's any other comments at this point, I'll just say thank you, folks, and enjoy the rest of your day.